for talking about the importance of personalised care, I mean, it is on the NHS 5-year plan, and I do believe AHPs are at the forefront of leading that because it is so inherent in the way that they practice, in the way that they interact with people, and really valuing what matters to that person and using it to aid their recovery. And in that way, as opposed to the medical model, which is very much being done to, you're being done with when you're working with allied health professionals.
From my experience, AHPs really can focus on that link between people's physical health and mental health. Understanding the relationship between the two of them can really maximise your engagement with your patient or your service user.
Yeah, totally agree. And I think, you know, we're understanding more, I think, about this overlap between people having long-term conditions and that having a significant impact on the mental health. You know, and I think about perhaps in my early days of practice when I was working in physical health and having somebody who I was seeing in clinic for diabetes, for instance, and them not being able to put in place some of the things we were suggesting and actually not really considering that their mental health might have been a barrier to that, and that actually having been diagnosed with a long-term condition might have resulted in anxiety or depression, and being able to treat both of those things and consider both of those things in a treatment plan being so important. And then vice versa, you know, I think about some of the people perhaps on our mental health inpatient wards and the effect that their blood sugar levels might have on their behaviours, you know, their mood, and that isn't always taken into account, I don't think. I think, you know, you have to consider both of those things together to actually really understand where somebody is.
From a physio point of view, we can't engage service users effectively unless we work together with the AHPs and other professionals. Everything from, you know, if I'm going to rehab someone and we think about someone's sleep hygiene or their dietary intake or them getting to the toilet, etc. If they can't do those things, then I can't be effective in my role.
I would agree, Naaman, and I think our allied health professional family is just huge, isn't it? So we've got those 14 professions and everybody brings something really unique to the table.
I think about some of those difficult professionals meetings or MDTs and the value of having that diversity in the room. So everybody's coming on the patient journey from a slightly different place and different perspective, and I think, you know, that collaboration just allows you to form a plan of care that really supports someone from a multitude of different viewpoints.
It's a much richer picture,
much
isn't it?
richer, yeah.
And that communication between teams and between individuals is key, because relationships between clinicians and service users can be very different just based on profession and what you have to engage these individuals with and in. So you might find a situation where a service user feels more comfortable to discuss a certain topic with a certain professional, and then that professional can appropriately share that information to enhance everyone's engagement with that person.
Yeah, totally agree. I've often come across, you know, I've been talking to a staff team and, you know, said, oh, not sure if so-and-so will talk to you, and then roll up and, oh, you just want to talk about what I eat? That's fine, you know, no problems at all. And it's sometimes that's the way in, isn't it, in terms of people feeling comfortable about a particular topic they see as less threatening. And then, you know, that engagement and that trust building then enables other professionals.
I was going to say that's often the road in, isn't it? Because they trust you because you're Carly and they know that you're okay. And then they've got maybe an issue that might need physiotherapy, and you can then support into working with Naaman and then into me. And I think often as well, different nurses and doctors might ask for a referral and they might not know exactly where that referral should go to. And us as AHPs, we can say, hey, it's not me, but it is Carly, it is Naaman. And we work so closely together that it speeds up the process, doesn't it? It gets the person the right input, the right treatment at the right time.
So I think the value that we bring. You know, we're a diverse range of professionals, allied health professionals, each with our own specialist knowledge, and I think incorporating us into teams is so valuable for spreading that specialist knowledge. I think about being invited to speak at doctors' away days, and what you notice following that is that rather than just asking the patient, are you eating regularly, they will suddenly say, and what is it that you're eating? Because they're like, oh yes, I remember we were talking about protein and pressure ulcers, and actually it's not okay if that's just jam on toast. I need to be finding out about protein intake. And then I think about my work alongside speech and language therapists in the team, and how they are then able to upskill me in using talking mats, and that enables me to bring my skill set in a whole new way of communicating with people that enables us to go forward. And I just think in terms of that knowledge sharing, it's so important because we all get better at what we do based on that.
I suppose in terms of sharing knowledge, allied health professionals are really, really skilled, I think, because they work in such a diverse number of roles. So we've got allied health professionals taking on matron roles in mental health now, which is great because you're sharing that specialist knowledge, but you're also empowering other members of the team as well. And we've also got allied health professionals who work in community teams, who are care coordinating people. So again, you've got that generic caseload where you're working alongside, but you're also giving your specialist spin on things as well.
With personalised care being something that I'm so passionate about, and there are quite a lot of AHPs that I know working in quite high up sort of positions, and they're able to then embed the personalised approach, which comes so inherently, is so inherent in the way that AHPs work to a team, and sort of spreading that personalised care ethos and way of working is a bit different. I am an expert by experience who works for GHC, and all of the people that have supported me in the roles that I've done have been allied health professionals, and I think that speaks volumes about the values of allied health professionals and how much they do value the person rather than like the systems and the medical model. I know I spoke about that earlier, but I've been supported to do some amazing things, and yeah, it's AHPs that have helped me do that.
It's so much more powerful working in a co-produced way because, as a clinician, I'm an allied health professional. I've got a lot of clinical knowledge, but I don't have lived experience of a mental health condition or a physical health condition. So there's always a bit of the jigsaw missing, really. And that's what you guys bring. That's what our lived experience practitioners, our peer support workers, our experts with lived experience, you bring the magic. And it's much more powerful in someone's recovery journey when you've got both. So you absolutely need clinical experience, but you absolutely need lived experience in equal measure.
The co-production element in terms of being an expert by experience can be a really important part of your recovery journey, in terms of like giving you self-confidence, giving you feeling empowered, feeling important, feeling valued, and also getting back into the real world after an experience in services, whether inpatient or outpatient therapy. It's just kind of, but you are supported as well, and in that way co-production can be a really important part of your recovery.
I think research is so fundamental in what we do. It's about how we prove what we do is effective. We know what we do is effective, and we know it makes a difference. And we have lots of qualitative ways of doing that, so we have lots of feedback, but research really solidifies what we're doing. It makes sure that we're using the best evidence-based practice available, and if that evidence-based practice isn't there, we're always at the forefront of creating that evidence and creating that research. So it's really good to embed it right at the beginning of your career, because it isn't I don't see research as something that you do, it's something that's embedded in the whole of your career, right from when you start university right through.
Yeah, completely agree. And I think it's often quite different. I think for, when nurses and doctors are working, I think their value is understood, and I think their interventions are understood. Whereas I think, thinking from a managerial point of view and pushing our professions forwards, so often it's, where's the value? can you prove what you do works? And that's where you need to know about the literature, you need to know what evidence is out there. And if it's not there, you're very aware of that and you know where the gaps are. So I think, you know, as AHPs, that need for us to drive the research agenda forward to improve patient care is always there. And you know, we've got a really important role within that.
And with a lot of AHP roles being quite young in the field of mental health, it just gives us a lot of opportunities to engage in research. It's almost, you know, fresh grass for us to graze on there.
I suppose prevention is such an important part of what we do. It's probably one of the most important things that we do as allied health professionals, I would say. It's about giving that control and that power back to the person. So it's about supporting self-management and often in mental health, living well with whatever condition you've got, because we know that recovery isn't a linear process. Recovery is like a roller coaster really, so it's about supporting and giving the person those tools and techniques to self-manage and to work on what really matters to them.
I think the potential for allied health professionals on, you know, to support the prevention agenda is huge. I don't think we're often given the time and the space to do it necessarily as well as we could. I think about a particular service user I worked with when I first moved down to Gloucestershire, and I was doing outpatient community clinics, and her care coordinator said, you know, this lady's heard that there's a dietitian and she'd love to speak to you. She really, really wants to improve her diet. And if you'd have worked on the medical model, she'd never have come through because she didn't have an overt micronutrient deficiency. She, you know, she wasn't particularly overweight or underweight, but she only ate 5 foods. And she'd reached a point where she understood that actually she needed to eat some fruit and vegetables and that would help her, but she didn't have the tools to do it. And so I said, yes, you know, bring her along, let's get her into clinic. You know, and 6 months later, she was having 2 portions of fruit and veg a day. And she, you know, was then going to work on increasing that. And that's not something she could have done just through acknowledging she needed to eat more fruit and veg. You know, there were complex reasons. You know, there was past trauma around meal times, there was anxiety, there was OCD that meant she couldn't do that on her own, but it was the right time for her with the right support. And, you know, in terms of prevention, that lady now may, you know, we've reduced the risk of her developing bowel cancer, you know, a stroke later on, dementia, because we've improved her diet at that point when she was ready to. And I think, you know, having access to AHPs at the right time to do the right piece of work, I think is really key.
And I think exactly that. And also, you mentioned about the right time. And I think quite often what you hear is someone's offered an intervention or a treatment and it might not be the right time for them. So 6 months, a year down the line, someone represents and they're told, well, you've had that before, it didn't work. Well, actually it wasn't the right time. And allied health professionals are really flexible and have got that ability to work with people at the right time when people are ready to find the right skills and the right tools. I think we've got a lot of opportunity in the future. Again, I know we've said our time is now, but it really is. Thinking about lots of allied health professional roles now in primary care settings and GP practices right at the beginning of people's journeys. So getting in early, supporting people to work on a prevention agenda straight away, and it's a really, really exciting time.